The executive summary. Caravan is mobile health care that will start serving 3 known homeless communities in Hillsborough County and Tampa, Florida. The purpose is to increase access to health care for our homeless population and to provide community resources on a referral basis that will address homelessness, mental health, and substance abuse issues. All age groups will be served. It is a multifaceted and collaborative effort that will involve federal, state, and local agencies. Partnerships will include local hospitals, the health department, shelters, churches, and nonprofit organizations. Fundraisers and community health fairs will be held. We will work to evaluate and continuously improve our efforts to serve and provide health care to our homeless citizens. Some definitions of homelessness. What is homelessness? First of all, you have unsheltered homeless people, and there are people who stay in places that are not meant for human habitation, such as streets, abandoned buildings, parks, and vehicles. There are sheltered homeless, which are people who stay in emergency shelters, transitional housing programs, or safe havens. There are chronically homeless individuals and families, and they have been continuously homeless for a year or more, or have experienced at least 4 episodes of homelessness in the last 3 years. Also, there are unaccompanied children, and they are children who are not part of a family during their episode of homelessness, and they're under the age of 18. And there are unaccompanied youth, and these are youth between the ages of 18 and 24. Homelessness in the U.S. In January 2014, there were 578,424 homeless people on any given night in the U.S. 135,701 were children under the age of 18. 84,291 were individuals. 15,143 were people and families. The homeless are men, women, children, and families. The state of Florida is actually third in the nation for homelessness, with 41,542. Half of the homeless population in the U.S. are in the 5 states that are represented. California has 113,952. New York, 80,590. As I said, Florida has 41,542. Texas has 28,495. Massachusetts, 21,237. 1 in 5 homeless people was located in Los Angeles or New York City. 45% of all homeless people and families were in major cities. In Hillsborough County, which is our location in Tampa, Florida, there are approximately 2,243 homeless people. 46% have a disability, which include mental, physical, developmental, or HIV or AIDS. 31% are women. 9% are under the age of 18. 11% are veterans who've served in the military, and 12% are Hispanic. There are some disparities that are common to the homeless. They suffer from what is known as trimorbidities, which is a combination of mental health illnesses, physical illness, and drug and substance abuse. They also have a higher use of emergency departments. 2/3 of their medical problems predate their homelessness. And if a homeless person is hospitalized, their hospitalization is usually 3 times longer than someone who is not homeless with the same condition. The homeless suffer from medical problems. There are neurological disorders such as alcohol withdrawal seizures, encephalopathy, post-traumatic head injury. Cardiac issues can include hypertension, drug-induced cardiomyopathy, or heart disease. Respiratory illnesses include TB, COPD, and pneumonia. They have systemic illnesses such as HIV. Gastrointestinal problems can include cirrhosis, gastritis, and peptic ulcer disease. They also suffer from vascular disorders, metabolic disorders, dermatological diseases, and foot trauma. Mobile health clinics are the answer for serving the homeless population. They provide health coaching and monitoring. They were created to overcome barriers to health care. There is an estimated 2,000 mobile health clinics across the U.S. They deliver cost-effective chronic disease management and disease prevention in underserved areas. Research shows that mobile health clinics are cost effective and they improve health outcomes. A program in Maryland saw a decrease in pediatric patients being admitted to the hospital with asthma related illnesses. The same program reported a savings of $3,500 per patient. A mobile health program in Boston reported a reduction in relative risk of heart attack of 32.2% and 44.6% reduction in relative risk for stroke. Mobile health programs also facilitate disease management for chronic disease states such as diabetes and high cholesterol. These programs have also been found to increase patients' compliance and health literacy. Mobile health clinics are improving access to health care. The types of clients served nationwide are represented in these graphs. In the pie chart, to your left, it shows that 45% of mobile health clinics serve rural and urban clients. 14% serve rural clients only. 41% serve urban clients. The bar graph shows that 51% of the clients served are uninsured. 36% have insurance. 57% are non-white, and 34% are Hispanic. Mobile health clinics are saving lives in underserved communities, and they are cost effective. The value of 12 mobile health clinics with the services that it provides is $83.8 million. Yet, the cost of operating the 12 mobile health clinics is $4.5 million. For every $1 spent, you have $19 worth of value. And also, with mobile health clinics, $4.5 million in emergency departments visits was avoided. And they also saw a $79.3 million in quality adjusted life years. So some things about Hillsborough County from our assessment. First of all, it has a population of 997,936. The per capita income from 2007 to 2011 was 27,282. There are 180,266 residents below the poverty level. That's 15% of the population. There were 154,844 residents households that received public assistance. And also 41,026 individuals are not proficient in the English language. So I used a community needs assessment framework from the CDC. And the assessment was conducted to diagnose the needs and readiness of the community regarding homelessness and mobile health care. The data collection method used included electronic and mail surveys. There were interviews of key stakeholders, community leaders, businesses, residents that was also conducted. The key findings, focus groups were used to synthesize the key findings. The consensus was that the community is ready to tackle the problem of homelessness and the high cost of healthcare. The synthesis. The most important community need identified was the lack of healthcare services to the homeless population. Also, a lack of support to our homeless citizens. The need for strong referral services to address homelessness was also identified. The recommendations was to provide mobile healthcare services to the homeless population of our community, and also to partner with federal, state, and local agencies for funding and resources. The community nursing diagnosis, based upon the assessment, there's a lack of access to healthcare services among the homeless population of Hillsborough County due to a lack of financial resources. There's also an increased morbidity and mortality rate among them. Based upon the diagnosis, an improvement in healthcare access is crucial. The community nursing diagnosis is in alignment with the Healthy People 2020 goals, which are national health objectives to improve the health of citizens and diminish health disparities and to increase health equality. Two of the focus areas are to improve access to health services and social determinants of health. Caravan addresses these issues by improving access to healthcare services to the homeless population in Hillsborough County. Here are some community resources for Hillsborough County that are currently available. Various services are provided by these agencies. First of all, there's 211 Tampa Bay, which is a crisis intervention and referral service, the Hillsborough County Citizen Action Center, social services, veteran services, employment assistance, the Hillsborough County Care Health Plan, and also neighborhood resource centers. So about our caravan, it will use the nursing practice model to offer primary care services, immunizations, education, and preventative services to our homeless population. We will use a case manager for each community to refer clients to the appropriate community resources. It will be staffed with one family nurse practitioner, one RN, two medical assistants, one social worker, and one security officer. We've actually partnered with the local police department who will provide that service. We will serve in 3 known homeless communities with a regular service schedule, and we will also partner with local pharmacies, the health department, 3 local hospitals that will provide lab services, churches, and homeless shelters that are local. There are some obstacles to our program. One of them being financial support. It will cost quite a bit to maintain our program, and that financial support will need to be ongoing. Also, we have to maintain our equipment and our vehicles. We have to make sure that our staffing is consistent and adequate. Also, there may be community and service access barriers. We may have parking challenges with our vehicle. We'll have to also maintain a generator for power. Also, there could be obstacles with obtaining the necessary medications and limited service abilities. We do not provide all the services that a hospital provides, and we may run into those instances where there may be a patient or a client that we are unable to help. So our logic model, we use the ecological approach for our logic model. Our situation is homeless individuals without health care in Hillsborough County. Some assumptions is that we will have community support and funding available, and some external factors actually include funding, medical equipment repair, and staffing needs. For our inputs, we did a very thorough community assessment and assessed our community readiness and also community resources and finances. Our outputs include we're going to provide primary health care. We need participation from our homeless individuals. And also, we'll provide those services of education and prevention and immunizations. And we also, as I said, need participation from the homeless population in those 3 communities that will be serviced. For outcomes, or this is what we hope to achieve, in the short term, we hope to achieve providing access to health care for our homeless population. Our medium-term goal includes increasing health literacy and participation in health care. And long-term, our goal is to decrease morbidity and mortality in our homeless population. Our goals will be continuously evaluated by use of our medical record-keeping system, surveys of our clients, and statistical data program that will monitor our healthcare outcomes. Thank you.